Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister, thank you for joining us.
Well, thank you very much for having me on your program.
All right, so Minister, straight into what's happening at the moment. Can you just give us a broad-based update, anything COVID-19?
Well, there are lots of things that are happening. As you know, last week we did launch Operation Covi Curb, which is intended to curb the spread of COVID-19 in Guyana. One of the pillars that we thought was lacking was enforcement. And so we had a strategy meeting with the joint services, the police, the army, the CDC, and out of those discussion emerged the idea of having this special operation, in a sense, of Covi Curve. And so we have launched that, and we have a number of the joint services ranks who are out, and they're where they see gatherings, they would go there, they would talk to people, persuading them that this is not the right thing to do, that you need to do your social distancing, and also to do personalized kind of education, because we have trained many of these persons who are volunteering and going out to be able to provide a flyer explaining the transmission of the virus, how you can get infected, and what you can do to prevent the infection. So we believe by doing that and encouraging people to do the right things, that we'll get more compliance. And we have also given to the joint services flyers that they can distribute when they go on these missions. In addition to that, they have masks. So if they see people not wearing the mask and they don't have a mask, we'll offer them a mask and get them to start wearing the mask, and also help with the education. So we really believe that with this kind of concerted effort that we have, that we are going to get more people educated about why they need to do this, and at the same time getting higher compliance. It's still early days to know how much this is affecting people's behavior, but certainly the feedback that we have received has been quite positive. We have also set up a hotline, so if there are any person who have seen gatherings and people are there and violating the COVID-19 order, they can call the hotline, and we will dispatch persons to see what is happening and to try to work with the crowd there, to ensure that things are okay. Now, one of the things that we also have been doing through this operation is working with businesses to also make them compliant. So we want businesses to have a sink so people can sanitize their hands, or if they don't have a sink, to put in place a methodology for you to sanitize your hands, whether you're using alcohol or some other form, that can happen. So that's something that we want businesses to do. Secondly, the amount of people that come into your business, you must have appropriate social distancing. And we want businesses to insist that persons must not come into their business if they're not wearing a mask. Right? So we are hoping that businesses can start enforcing these rules. And if businesses violate these rules, then we are going to warn them. And the second time around, we can take away your license until this pandemic is over. The rationale behind all of this is that if we are going to secure the health of the nation, then every single Guyanese must play a role. We are not safe as individuals unless all of us are doing the right things. And that entails each one of us playing a role to secure the health of this country, right? So that's an important thing, and that's the underlying rationale behind this operation that we have.
All right, Minister, if I can ask, you could have taken several different approaches. Why this specific one?
Well, this approach really, we have been running a lot of campaigns and so, and we recognize that this is one of the weak areas, the enforcement. But we don't want to be, harsh with our enforcement because the law provides for us to lock people up, for us to fine people if they're violating these rules, right? We prefer initially to use a softer approach, but if people are not going to comply, then it leaves us with very little alternative but to go to the more harsher means. So we want to start with the softer things and get people to comply. And once people comply, then we don't have to use the other harsh measures, right? And that's the rationale, because we honestly believe that if we educate people and people understand the rationale behind why you need to wear a mask, then they will comply, right? So the education is very important, and that's the reason why we have taken this approach, trying to have that kind of education going on. So basically, it's the persons from the Army and police and CDC and other volunteers that we'll be having. They would really be doing personalized education, because when they meet people on the road or in a gathering or wherever, they're literally talking to people and educating them, and then reinforcing that education by leaving a pamphlet with them that they can read. And we are hoping that the people who receive these things also read it. It's very simple to understand, and share it or help other people in their homes and community to understand the rationale. So while we might initiate the process, we are hoping that it creates a chain. So we start, people now have the information, and they can pass it on to other people, whether they're friends, their relatives, their neighbors, people in the community. So we are hoping that this thing would create, in a way, a kind of movement for educating people on COVID-19. So we are just maybe the initiators, the catalysts of it, but we are hoping that this thing would grow and more people would understand the rationale behind this.
Okay. Minister, by now we know the persons that are more susceptible to COVID-19, but I noticed that the ministry has also been specifically targeting pregnant women, expectant mothers. Why is that necessary?
Well, we have had a number of cases where expectant mothers, when they come into our facility, before they come, they're COVID positive. And, if they're COVID positive, then we have to create other conditions in the hospital for those deliveries. So we'll prefer mothers not to be COVID positive. And that's why these mothers ought to take the precautions like everybody else. However, when they come into the hospital, if they do test positive, then we will isolate and we will have all the relevant protocols in place so as to ensure a safe delivery. So we have put that mechanism in place at all of our hospitals, but the better thing is prevention. Right? On the other hand, there are other categories of people that we want to ensure that they're safe. And basically, they fall into two major groups. One is older people, and that when we say older people, we're talking about persons 60 and above. 60 might not sound like being too old, but from the statistics that we're seeing, that most of our deaths are occurring with people 60 and over. So you have that grouping of people that accounts for the majority of our deaths. So trends in other parts of the world have shown that age, the older you are, that it plays a role in this pandemic. And therefore, we want our older persons to abide by these rules more stringently and so forth. If they don't have a reason to be out in the public and things like that, then they should stay at home. If they have a reason to be in the public, then abide by the rules. Sanitize, wear mask, keep your social distance, and things like that. So we want people to be compliant. So older persons is a group of people that we have identified as being at increased risk for this disease. In addition to older persons, your risk goes up if you have underlying diseases. We have seen again with our figures and with what is happening globally that if you're a diabetic or if you're hypertensive or if you have cardiovascular diseases or for that matter any other disease, then adding COVID onto that creates more difficulty for you. So you will experience COVID in a more severe form. Sometimes that requires hospitalization. And for some people, even while you're in hospital, you might require ICU care. So again, we want persons who have these underlying illnesses to be extra cautious and to ensure that they're wearing masks and keeping their distance and so forth, because this is extremely important, right? We can't say that this person is going to get it or that person is going to get it. It's not like that, right? We know from what has been happening that some people would experience this disease in its severe format, and maybe it has to do something with the person's genetical makeup, but we don't have all the details of why this person would be affected more versus another person. But what is emerging is that persons generally who have these other illnesses, they tend to have a harder time. They tend to experience a more severe form of COVID-19, and in some cases they require ICU care. So again, that's why we want to ensure that people who would have these underlying conditions, that they take extra precaution and reduce the risk of COVID-19.
All right, Minister. Before we wrap up, I wanted to touch back on Covi, right? I know it's nationwide, so I just want to make sure that everybody knows that it comes to their region,
Yes.
right? Aside from the joint services, who else are involved? And
So-
is there a time frame as to how long this campaign will
So
run?
right now we are going to do it for the whole month of October, and then we'll review. And in addition to the joint services, we are recruiting a number of volunteers to work along with the joint services. So people, if there are people who have an interest in helping, we know there are lots of religious organizations or NGOs or people generally in their community who might want to be part of this. They can contact the COVID Secretariat and we can see how we incorporate you in the region where you're living, in the place where you're living. So you don't have to come volunteer. If you're living, say, in Parika, you don't have to come and volunteer in Georgetown. We'll work with you in your community. So you can help us to distribute some of the flyers, talk to people, and so forth. And we'll get the material to you so that you can help us with the distribution and things like that. So I know there are people who would want to help. And if you want to help, then please contact us in the COVID Secretariat and we will organize for us to send material to you and coordinate with you so that we can have faster outreach and reach more people out in the community.
All right, if I can just ask you quickly on the Diamond Hospital, I know it's en route to become a smart hospital.
Sure.
Just a general update as to how that's going.
Well, currently in the ministry, we have 5 hospitals that we're looking at to make them in what is called a smart hospital. So we have Diamond, that where we have started. We are going to do the same thing at Lenora, Mabaruma, Lethem, and Paramakatoy. So these are all hospitals that are slated to become smart hospitals. What do we mean by smart hospitals? One, we want to have better patient flow in the hospital so that there's a logic behind how people, if they have to wait, they don't have to go till around the corner to get a diagnostic test. Things must be like within their reach, right? So we have redesigned the hospital to ensure that this happens. In addition to that, hospitals tend to consume a lot of energy, power. And we can utilize renewable energy sources to reduce the power footprint of a hospital. And so, like with Diamond and the other smart hospitals, a substantial part of their energy needs would be covered by solar. And they have other things that we are doing internally to reduce the power load. So the appliances that we'll be using are going to be less, would take less power. So all these are going to be like smart appliances that would reduce the power load. In addition to that, we are going to use like digital X-ray equipment. And with those digital pieces of equipment, instead of having the old-fashioned X-ray film, you wouldn't need that. You will have a digital printout of the X-ray, or you can view that X-ray on a screen. Now, that adds capability for us, because if we don't have a radiologist on site, we can email that image to a radiologist, whether in Georgetown or internationally, and they can review the X-ray for us and send back a result to us. So utilizing these electronic tools, so to speak, and using the internet to send these imaging to and in some cases we are planning to have real-time consultations, that this would then widen the scope of services that we can offer and offer it more efficiently. So these are the kinds of innovations that would happen at the hospital, and Diamond is the first one to do so. We are also in that space. We have also put in a modernized pharmacy, a modern laboratory, so that a lot of the tests that people would have to get done, they will be able to get it done there. Now, a lot of the physical work is still ongoing, but while work is ongoing, a part of the hospital still remains operational. And that part has to do with the maternity section. So mothers who are expectant, they can come in there and they would still receive services, even while we are fixing up other parts of the hospital. We have a team from the ministry, and we have a team from PAHO WHO that is having oversight over the construction, and they have been meeting regularly to check on progress. So we are hoping that we can get that hospital fully operational as early as possible. But this one being the first, there are many innovations, and there were things and so forth that perhaps we didn't anticipate might take so long, that might delay us here and there a little bit. But I must say I'm impressed with my last visit there, that all the persons on board have been working very hard to make sure that we return the facility and return service to the people who need it on the East Bank. But once we complete there, we are going to go to the other hospitals, and we have money to do the 5 that I mentioned, and this is funding coming from the British government, And they have also funded a study where we have looked at another 100 health centers and district hospitals around the country to, to redesign them, to make them into smart hospitals or health centers. So you would see the future projects that we'll have would all utilize this concept of smart hospital, meaning renewable energy, getting them internet ready so that we can utilize the internet technology, making sure we have better workflow, putting in the diagnostics and so forth. So the types of facility that we'll be getting in the future would be upgraded and services would definitely be improved.
All right, Minister, thank you so much for speaking with us today.
Thank you.